Thank you. Thank you, Don, for that kind introduction. I've been really enjoying my time so far in Tennessee, and I'm glad to be here today with you. I admire and appreciate your 6 years of service to DOJ and your service as a state prosecutor in Alabama. Thank you for your 9 years also as active duty Army Ranger and Army Special Forces. That's probably the kind of work that makes putting criminals in prison like an easy job. And I appreciate your service, and I honor that. Thank you also to Doug Overby from the Eastern District for being here. Thank you for Mike Dunavant. I enjoyed spending time in Memphis with you and enjoyed going to Rendezvous Barbecue. Had a good time. We're going to try to get them an Iowa Hawkeye football helmet to hang up there next time. And, of course, really the person that's the brainchild of the person that created this idea of the RPOs and has really seen it to fruition. Brian Benchkowski, the Assistant Attorney General for our criminal division, and a true friend and a true leader at DOJ. So, Brian, I'm glad you're here. Chris Evans, also from the DEA in Louisville, has joined us today. I also want to recognize Criminal Chief Brent Hannafin, who is a proud Iowan. Brent, thank you for your service to the department. As a former U.S. attorney myself, I know how important U.S. attorneys and our AUSAs are to the overall efforts here at the Department of Justice and in keeping our communities safe. Thank you all for your hard work and sacrifice to reduce crime and fight the opioid crisis. I was in a briefing earlier and heard really about the frontline efforts in this office to address these concerning numbers. And because that work is more important than ever. Today we are facing the deadliest drug crisis in American history. Last year, 70,000 Americans lost their lives to drug overdoses. That is the highest drug death toll in American history by far. It's the equivalent of the population of Jackson, Tennessee, being dead all in the course of 1 year. More Americans have died of drug overdoses this last year than in car crashes. Despite rising prosperity and better technology, life expectancy in the United States has actually declined, we found out, the last 3 years in a row, largely because of the opioid epidemic. The last time life expectancy declined 3 straight years in this country was a century ago, in the middle of World War I, together with the flu epidemic. This is not acceptable. The overdose deaths don't tell the whole story. Millions of Americans are living with the painful consequences of a family member's addiction or the addiction of their own. I personally know people whose families have been impacted by drug addiction. We all do. Appalachia has been especially hard hit by addiction and opioid fraud. Some of the first pill mills in America were started in southern Ohio, Kentucky, and West Virginia. And the first day, this Appalachian communities still have tragically, and to this day, these Appalachian communities have tragically high rates of addiction and overdose. Here in Tennessee, drug overdose deaths have gone up by about 50% since 2013 and reached record highs. Here in the Nashville area, the increase has been even bigger, an 88% increase since 2013. In 2017, Davidson County was second in the state for overdose deaths. The vast majority of these overdose deaths are from opioids. Heroin deaths have increased more than 5-fold in the Nashville region since 2013. This is a daunting situation. Your work has never been more difficult, but it has never been more important. The Trump administration has your back in these efforts. The President has laid out a comprehensive plan to end this crisis. The President's plan includes 3 parts: prevention, enforcement, and treatment. President Trump has improved our prevention efforts by launching a coordinated national awareness campaign about the dangers of opioid abuse. And he is a strong supporter of law enforcement as well. Under his leadership, the department has put a special focus on fighting the deadliest drug today, synthetic opioids like fentanyl. These drugs are so powerful that it takes the equivalent of a pinch of salt to be deadly. Not only are they powerful, but they are also too easy to get. You can go online and have them shipped right to your door. And I've seen the mail facilities which this international mail is coming through, and it is frightening, the capacity for them to receive mail, the amount of mail they receive and have to process so quickly with all these deadly drugs coming into our country internationally. Over the past 2 years, synthetic opioids have killed more Americans than any other kind of drug. Last year, these drugs killed more than 29,000 Americans alone. And so we've placed a special focus on prosecuting fentanyl cases over the past 2 years, and we're getting results. Last July, the department announced the seizure of a website that was the largest darknet marketplace in history. It was called Alpha Bay. It hosted more than 220,000 drug listings and was responsible for countless fentanyl overdoses, including the tragic death of a 13-year-old. In August, we announced charges against a married couple who had sold fentanyl on Alpha Bay. We believe they were once the most prolific opioid trafficker on the dark net in North America. We also worked with our partners in Canada to help them indict a man who was believed to be the third most prolific darknet synthetic opioid dealer in North America as well. In January, we began our J Code, a new team at the FBI that focuses specifically on the threat of online opioid sales. They have already begun carrying out enforcement actions nationwide, arresting dozens of people across the country. We know that the vast majority of the fentanyl in this country is made in China. That is why the Trump administration has become the first administration to prosecute Chinese fentanyl traffickers. Last year, we announced the first 2 indictments against Chinese nationals for trafficking synthetic drugs in the United States. And then in August, we announced our 3rd case, a 43-count indictment against a drug trafficking organization based in Shanghai. This last August, I went to China, and I met with the Chinese law enforcement officials to discuss this specific problem. I made it clear to them that we want them to be partners in this effort, and that they've got to do more to stop fentanyl and synthetic opioids from coming into our country. Nevertheless, we are interdicting drugs coming into the country at higher and higher levels. In fiscal year 2018, which ended on September 30th, the DEA seized 6 tons of heroin, more than 100,000 pounds of methamphetamine, and nearly 2 tons of fentanyl. That's 70% more fentanyl than the year before. And that's enough drugs to kill every man, woman, and child in the United States. Those interdiction efforts are important and necessary, but we know that one of the major causes of the opioid crisis in the first place is overprescribing. We're told that 3 out of 4 heroin addicts in the United States first started on prescription opioids. Even if that is an overestimate, it is still way too many. That's why President Trump has set the goal of reducing the national opioid prescriptions rate by 1/3 in 3 years. It's an ambitious goal, but we are well on our way to achieving it. According to the DEA's national prescription audit, in the first 8 months of 2018, opioid prescriptions were down by nearly 12% compared to the year before. And that's in addition to the 7% decline we saw last year. So we're almost 20% of that 1/3 goal. We now have the lowest opioid prescription rates in 18 years, and we're going to bring them a lot lower. We also are lowering the legal limits on opioid production. For next year, the DEA is lowering them by an average of 10%. That will bring us to about 44% decrease in opioid production since 2016. We are making it harder to divert these pills for abuse, and we're going after the fraudsters who exploit people suffering from addiction. 2 years in a row, the Department of Justice has set records for healthcare fraud enforcement. This July, we charged 601 defendants with more than $2 billion of medical fraud. This was the most doctors, the most medical professionals, and the most fraud that the Department of Justice has ever taken on in a single law enforcement action. This is the most defendants we've ever charged with healthcare fraud and the most opioid-related fraud defendants we've ever charged in a single enforcement action. So far, under President Donald Trump, the Department of Justice has charged more than 220 doctors with opioid-related crimes and convicted more than 80 of them. 16 of these doctors prescribed more than 20 million pills illegally. We have also charged another 221 other medical professionals for opioid-related crimes. To those doctors that continue to overprescribe opioids, we know who you are. We're coming to get you. In fiscal year 2018, we charged 6% more drug defendants overall than in 2017. We prosecuted 36% more opioid defendants than the previous 4-year average. We increased heroin prosecutions by 14%, Oxycontin prosecutions by 37%. We are prosecuting more fentanyl defendants than ever before, as I mentioned previously. More importantly, however, overdose deaths in this country may have finally stopped rising and are finally coming down. From 2012 to 2017, drug overdose deaths per year in this country increased by a shocking 74%. According to the CDC, overdose deaths increased on a month-to-month basis until last September. The rolling 12-month total then decreased by 2% from September 2017 until April 2018, which is the most recent data we currently have. These are preliminary numbers, and we want to make bigger decreases. But this is good news. And we're not going to stop there. We are continuing to support you in law enforcement, you in prosecution, and we are going to help you succeed. Last month, we announced the new Appalachian Regional Prescription Opioid Strike Force. This new strike force will be composed of 12 additional opioid prosecutors across our 9 Appalachian districts and the surrounding area. Each one of these prosecutors will have their own team of federal investigators and law enforcement agents. They'll also be mobile, so if a small case turns into a bigger case, then we can prosecute it in whichever district we find it. The northern hub of the strike force will be based in Cincinnati, which is just outside of Cincinnati in Fort Mitchell, Kentucky. The southern hub of that strike force right here in Nashville, Tennessee. We've already used the strike force model to combat healthcare fraud, and it's been very successful. We want to replicate the success in this fight against the opioid epidemic. This new strike force is going to build on the successes that we have already achieved over these past 2 years, and I believe that it will help this area gain some relief. I especially want to thank Matt Miner and Joe Beamsterboer for their great work in setting up the ARPO strike force. I know that you spent countless hours on the road over the past couple months, meeting with U.S. attorneys' offices, meeting with law enforcement, and putting this together. But I also know that your tireless effort, in conjunction with the work of the strike force prosecutors and the AUSAs in the United States Attorney's Office, will pay countless dividends. And Brian, I want to thank you for reaching out to those healthcare task force members and seeking volunteers. I know how proud of you are that they raised their hand. You were hoping you would maybe get a dozen, and you had 18 volunteer to come wherever they could to address this important problem. This is our latest step, announcing the ARPO, but it is not our last. We are going to keep pace, we're going to keep pressing, and we're going to continue the momentum. We're going to continue to support you in your efforts, giving you new resources and new weapons. We are going to keep coordinating with you and listening to you about how we can help. And so I want to conclude these remarks with encouraging those that are working on the ARPO effort, those that are working on the opioid crisis, and to all my fellow Americans. We know the problem, and we are going to do everything we can every day to address it so that we can save lives and make sure that America continues to be the most prosperous country in the world. And as my mentor in this job would often say, we have your back, you have our thanks. Thank you for being here today, and God bless the United States of America.